Welcome to today's episode. I'm thrilled you've joined me for this important conversation. This is a companion episode to the invaluable course titled Suicide Assessment Management and Treatment Training, offered by Therapy Trainings. If you're a mental health professional, counselor, or therapist, this episode is crafted just for you. Today, we're diving deep into the intricate world of suicide assessment, management, and treatment. We'll explore key concepts from the course, bust some common myths, and provide additional insights that can enhance your practice. So, what can you expect to learn in this episode? Well, we'll cover the importance of thorough suicide risk assessment, the best practices for intervention, and effective treatment strategies. We'll also take a moment to address some prevalent misconceptions surrounding suicide and mental health, and we'll wrap things up with some thought-provoking reflections and a call to action. Let's get started. Let's begin by discussing the core of suicide assessment. The first critical point to understand is that suicide risk assessment is not just a checklist of questions. It's a nuanced, dynamic process that requires both skill and sensitivity. In Therapy Training's course, we learn that a comprehensive assessment involves understanding the individual's personal history, current mental state, and the context of their life circumstances. This means it's essential to ask open-ended questions and create a safe space for clients to share their feelings and experiences. For instance, when you begin your assessment, you might ask, "Can you tell me about what's been going on in your life?" This opens the door for clients to express their thoughts and feelings freely. You'll want to listen actively and empathetically, as this builds rapport and trust. Remember, the goal is to understand the person behind the statistics. Each client has a unique story, and it's our job to uncover that narrative while assessing the risk. Now let's talk about some of the risk factors that you might encounter. The course emphasizes that risk factors can be categorized into three broad domains: individual, relationship, and societal factors. Individual factors might include previous suicide attempts, mental health disorders, substance abuse, or chronic illness. Relationship factors could involve social isolation, family conflicts, or significant life changes. Societal factors might include cultural stigma surrounding mental health or lack of access to care. It's crucial to recognize that these risk factors don't exist in a vacuum. They often interact with one another, creating a complex web that can elevate a person's risk for suicide. Therefore, when conducting an assessment, consider asking about these various domains. For example, how have your relationships been affecting your mood lately? This can help you paint a fuller picture of the client's situation. Of course, assessment is only one piece of the puzzle. Once you've identified a risk, the next step is intervention. The course provides several evidence-based strategies that can be incredibly effective. One of the most significant interventions is the creation of a safety plan. A safety plan is a personalized, practical plan that clients can use when they're experiencing suicidal thoughts. It typically includes warning signs, coping strategies, and a list of supportive contacts. Creating a safety plan not only empowers clients, but also gives them concrete tools to manage their crises. For instance, if a client identifies that they feel overwhelmed when alone, their safety plan might include reaching out to a trusted friend or engaging in a grounding exercise. As mental health professionals, we need to guide our clients in developing these plans and remind them that it's okay to seek help in tough times. Another effective intervention discussed in the course is the use of cognitive behavioral therapy, or CBT, which has shown promise and reducing suicidal ideation. CBT focuses on identifying and challenging negative thought patterns. For example, you might work with a client to identify automatic thoughts like, "I'm a burden," and help them reframe it to something more constructive, like, "I have challenges, but I also have strengths." This reframing can be a powerful tool in reducing feelings of hopelessness and despair. Now, let's pivot a bit and address some common misconceptions about suicide and mental health. It's essential as professionals to be aware of these myths and to educate our clients and communities about the realities of suicide. One of the most pervasive myths is that talking about suicide will make someone more likely to act on those thoughts. In reality, discussing suicide openly can provide relief and validation to those who may be struggling. It can help them feel less isolated and more understood. So, don't shy away from these conversations. Approach them with sensitivity, and remember that your willingness to listen can be a lifeline. Another misconception is the idea that suicide is always impulsive. While some people may act on impulse, many individuals experience a long period of suicidal thoughts before taking action. Understanding this can help us approach our assessments and interventions with the nuance they require. It's essential to ask about the frequency and duration of suicidal thoughts, as this can provide insight into how to best support the individual. As we continue to explore these topics, I want to emphasize the importance of ongoing education and training in our field. The course offered by Therapy Trainings is a fantastic resource, providing evidence-based strategies and insights that can help us better support our clients. I encourage you to visit therapytrainings.com to explore this course and others like it. Continuous learning is key to staying effective and informed in our practice. Now, let's reflect for a moment on the emotional weight of working with clients who have suicidal ideation. It's a heavy burden to carry, and self-care is vital. As professionals, we often get so wrapped up in caring for others that we forget to care for ourselves. Remember, you can't pour from an empty cup. So take time to engage in activities that rejuvenate you, whether it's spending time in nature, pursuing a hobby, or simply taking a moment to breathe deeply. In conclusion, today we've explored the intricate layers of suicide assessment, management, and treatment. We've discussed the importance of understanding risk factors, engaging in effective interventions, and dispelling common myths surrounding suicide. Remember, each client is a unique individual deserving of compassion and understanding. As you move forward in your practice, I encourage you to take these insights with you. Conduct thorough assessments, create safety plans, and embrace open conversations about suicide. Each step we take as mental health professionals can make a difference in someone's life. Thank you for joining me today. I hope this episode has sparked some new ideas and reflections for you. Don't forget to visit therapytrainings.com for more resources and courses that can enhance your skills and knowledge. Let's continue to grow together, supporting one another as we navigate this challenging but rewarding field. Until next time, take care of yourself and those you serve.